Hello there. Welcome to the Houston SPCA. I am your host, Dr. Roberta Westbrook, and you're here with us at the Campus for All Animals, and we have an exciting topic for you on today's Pet Pawcast. We're going to talk to you about a very common condition that happens in dogs and cats known as diabetes. So if you're out there and you didn't realize that diabetes occurs in dogs and cats, well, I'm here to answer all your questions related to diabetes today. So think about any questions that you have and feel free to put them in the chat. In the meantime, I do want to introduce you to our wonderful pet of the week this week. This is an adorable kitten named Jerry with a G. And Jerry is a young kitten that came to us last week on our ambulance service. And Jerry had a severe injury to her tail that we call a degloving injury, where all of the skin had come off of her tail and that tail needed to be amputated, but she is doing so wonderful. She's ready for adoption. Very, very cute. And so we would love for you to come meet Jerry and all of our other pets that we have available for adoption in our adoption center. So thank you for joining us once again. And we're going to get started talking about diabetes in dogs and cats. What questions do you have?
All right. So what exactly is diabetes? And how similar is it in pets versus humans?
Great place to start. So what is diabetes? Diabetes is a condition in which your pet's blood sugar level is higher than it should be over a prolonged period of time. So we want the blood glucose or blood sugar levels to stay within a particular range. When they stay too high and they're outside of that range, there can be health problems. And that disease, that syndrome is called diabetes. It happens in people, it happens in pets. Now, there are two types of diabetes. The first one we call type 1 diabetes. Type 1 diabetes is when the pancreas, which is an organ that produces insulin, when the pancreas does not produce enough insulin for our body to use sugar. So our cells in our body have to use sugar or glucose for energy. And that sugar, that glucose, needs to be inside of our cells in order to be used for energy. And the molecule that helps that happen is called insulin. We need insulin for our cells to be able to use that sugar, that glucose. Well, when our pancreas does not produce enough insulin, then our cells don't get the sugar that they need for normal function. We call that type 1 diabetes, when there's not enough insulin production. Type 2 diabetes is when the body does not respond to insulin normally. So it isn't because the pancreas isn't making it, it's because our body is not using it well enough. We call this type 2, and this generally occurs in pets that are overweight. So we call it a relative insulin resistance, where pets are overweight, maybe they need to change in their diet, and that's type 2 diabetes. Type 2 diabetes is more common in cats, and type 1 diabetes is more common in dogs.
All right. So how is it diagnosed? Are there any symptoms that we look out for?
Right. So diabetes typically occurs in pets that are older, although type 1 diabetes can occur in young animals. Typically, the signs that you're going to see that might indicate diabetes are going to be 4 symptoms. One of them is polyuria. Polyuria is the medical term for urinating more frequently than normal. The second one is polydipsia. Polydipsia is the medical term for drinking more water than normal. The third symptom is polyphagia. Polyphagia is the medical term for eating more food than normal. And then the final fourth symptom, or final fourth most common symptom, is weight loss. And so you might see eating too much, and even though they're eating too much, they're losing weight, they're drinking a lot, and they're subsequently urinating a lot. So you might notice these things in your pet. When you see these 4 things or a combination of them, please see your family veterinarian. The way that we diagnose diabetes is by doing a blood test. So your veterinarian will collect a blood sample and take a look at those blood glucose levels. They will oftentimes collect a urine sample as well and evaluate the urine for its sugar levels. And using those 2 things along with the history, can help us to diagnose your pet with diabetes.
And so if my pet is on a free feed diet, should I change schedules? Should I change it to a schedule feeding so I can see if the diet changes?
So let's say that your pet has been diagnosed with diabetes. One of the ways that your veterinarian may choose to manage the condition is to do a diet change, because the diet can affect how the body uses insulin and how the body processes sugar. So one of the things your veterinarian might do is to put your pet on a prescription diet, one that maybe has lower carbohydrates, sometimes higher protein, or more complex carbohydrates, so it doesn't turn into free sugar as easily. And your veterinarian may also instruct you to feed your pet in meals. But it depends on your pet, your lifestyle, and the treatment plan that your veterinarian describes. But sometimes meals can help us to predict your pet's sugar levels throughout the day, and it helps us to predict how and when the medication is going to be most effective.
And is developing a cataract something that is common for dogs, or is that like a myth that all dogs that have cataracts have diabetes?
That's a great question. The cataracts that can occur with diabetes. So diabetes, when it's left untreated, can lead to other symptoms other than the four that I mentioned before. One of those symptoms is cataracts. We do see cataracts more often in dogs, and that's because the blood glucose levels can go into the eye, into the cornea of the eye, and glucose is such a heavy, thick molecule that it pulls water toward it. And so when there's a lot of sugar in the eye, it draws water into the eye, making it more cloudy. And we do typically see cataracts more frequently with type 1 diabetes that occurs in dogs.
All right, so how do we treat a diabetic pet?
So, treating diabetes can be complicated, but there's a few mainstays. The first thing, again, I mentioned is diet change. Your veterinarian is probably going to give you recommendations on changing your pet's diet and perhaps even changing your meals and meal times and frequency. The second thing is going to be the providing insulin to your pet. So when your pet either does not produce enough insulin or is not responding to insulin well, one of the ways that we can help is by giving insulin through a needle, like a shot or an injection. And so what your veterinarian will do will typically start your pet on a particular type of insulin that he or she feels is best for your pet and their type of diabetes. And then they may even teach you how to give these daily insulin injections and tell you how frequently to give them and how much. So diet change and providing insulin on a daily basis are really the two foundational methods of treating your pet with diabetes, keeping those blood sugar levels within normal range and preventing all of the clinical signs that we spoke about earlier.
And so do we have to inject the insulin ourselves, or is that done in a clinic, or how does that look?
Yes, it can be scary when you first hear that your pet might need daily injections, and you're wondering if you have to take your pet to the veterinary clinic every day, or are you as a pet parent giving those injections at home? And the answer is your veterinarian or veterinary technician will teach you how to give these injections properly. And we want you to be able to give these injections so that they can be done on a daily basis in the comfort of your home, and you will not have to bring your pet to the veterinarian every day to have this done. The needle is very small. Typically, the amount of insulin given is very small, and so your pets tolerate this medication very well.
And so that's something that the vet can teach us how to do.
Absolutely. You will be taught how to do that, so no worries. We won't just send you home with the needles and the medication. Your veterinarian will make sure that you're comfortable administering the insulin injections, and they will watch you the first couple of times to make sure that's done correctly. And they will also instruct you on what to do if the medication is given incorrectly. It certainly can be overwhelming at the beginning, but once you get the hang of it, it works really, really well. And it's a great way for you to help contribute to getting your pet in a healthy, happy state.
Are there any pills we can replace with the injections or not at the moment?
There are some oral medications that can be given as supplements to the treatment. And usually when we give oral medications, they're medications to help slow down the absorption of glucose so that the blood sugar levels don't spike so much. And so there are some medications that can help slow the glucose breakdown. But typically they are not a substitute for insulin. Insulin is going to be the most effective way to bring those blood sugar levels down and to make sure that pets stay healthy.
And will they have to be on insulin their whole life then?
Typically they are on insulin lifelong. However, there are some cases where pets that have type 2 diabetes, usually cats that are overweight, can control their sugar levels with diet and weight loss. So it is possible to reverse diabetes, particularly when we find it early, and we can change the composition of the body with diet and exercise and weight loss. It is possible to reverse diabetes in your pet. It's most common in type 2 when it's an insulin resistance sort of situation.
And so you talked about reverse. What about preventing type 2 diabetes? What are some tips?
Great. Preventing type 2 diabetes would be just that, making sure that your pet stays at a healthy weight and not becoming overweight. So diet and exercise are key. I know we hear it all the time from our doctors and in the human medicine world. We say the same thing in animals, that diet and exercise are key to a long, happy life. So keeping your pet at a healthy weight, not allowing your pet to become overweight, can actually prevent type 2 diabetes or insulin resistance in your pet.
And can that treatment be expensive? I mean, with all the vet visits and stuff?
Initially, treatment can be expensive because we're trying to diagnose your pet, and it usually requires regular blood work to be done, and you're purchasing medication throughout your pet's lifetime, but it can be managed. And with, again, diet and exercise, sometimes that can be the bulk of your pet's treatment, and a lot of additional medications may not be necessary depending on how severe the case is.
Can diabetes lead to other complications or other illnesses in the pet?
Sure, untreated diabetes can certainly lead to other things like cataracts, and it can affect the liver, it can affect the kidneys. It can even affect your pet's nervous system. So we want to make sure that we diagnose it early, that we get your pet on treatment, and that we keep that blood sugar level regulated. One of the ways that your veterinarian will monitor your pet is by doing regular blood glucose level checks. And you might wonder, well, how do I do that? Do I need to take my pet directly into the veterinarian for these regular checks? And at first, that might be necessary. But technology has allowed us to be able to monitor your pet's blood glucose or your pet's glucose level at home. And there's a way that we can do that where your veterinarian can implant a skin monitor that is a little probe. The probe is injected under your pet's skin, usually somewhere on their back or their side. And this probe measures the glucose level around the cells right underneath the skin. And it can give us an indication of your pet's blood glucose level. So this probe that's injected under the skin, even though it's not inside a blood vessel, it's sitting right around the cells. And so it can give us some guesstimate of what your pet's blood sugar level is. And that's a way that we can monitor your pet's sugar level without drawing blood very frequently, which can be stressful for the pets. Your veterinarian can talk to you about the device that helps us to do that, and we can monitor your pet's sugar level on a more consistent basis.
And does it shorten the life expectancy of our pets?
So diabetes can shorten your pet's lifespan, particularly if it goes untreated. But oftentimes, well-treated diabetes pets can live years after diagnosis. So it really is just keeping that blood sugar level regulated, and that can mean frequent visits to the veterinarian, but it's very possible for your pet to live a very happy, long life, even with diabetes. Well, we thank you for joining us today on the Pet Podcast and learning a little bit about diabetes. We want you to partner with us because we have an exciting event coming up in 2024, and that is the Chevron Houston Marathon. next year is the Houston SPCA's 100th anniversary. And to celebrate our 100th anniversary, we would like to get 100 team members to help us run for a reason. So please go to our website, get more information about joining our team and running and participating in the Houston Chevron Marathon. You can do a marathon or a half marathon or a 5K, however you'd like to participate. You can even just kind of stroll a nice 5K. We would appreciate you joining our team. So thank you so much for all the support that you give us. And we are happy to see you next week here on the Pet Pawcast. Again, I'm your host, Dr. Roberta Westbrook, and we're here at the Campus for All Animals. See you next week.